On Monday, the 7th of June, the federal government realised our deficit of a ridiculous, malicious and entirely immoral budget meant we had to make some huge reform. No, we didn't finally start taxing large retailers like Apple. No, nor did we ask for all the JobKeeper money our mates at Harvey Norman stole from your pocket. Oh no, we found a more efficient way to get back in the black. Why bother with proper tax reform that takes from the wealthy? Why'd we do that to our mates, to our top dogs, our shareholders? Why should anyone of financial worth, the only worth, be punished for not being a failure? That's not the Australia we want for our children, with a barrier reef instead of another Nick Scali store. Our solution was much simpler. Let's slash moral and social safety nets put in place to protect your lives, health and future. Privatising healthcare does wonders for nations. Just look to America. I mean, why should there be Medicare rebates for hip, shoulder, hand and cardiac surgeries? I don't even know what a cardiac is. It's not like it's even important. Now, we're not completely heartless. We did give the medical industry exactly 1 month to try and update thousands of systems and hospitals across the country. But that's not our problem either. Now, we know what you're thinking, but this is when we ask you, the common citizen, the 99%, to pull yourselves up by those bootstraps and tighten those belts and pinch those pennies, all assuming you don't need any surgeries on your hands. Before anyone has a heart attack, just let me say this. As the Fibrils, you can trust us. You can accept the harsh realities of our Ayn Rand dystopian nightmare, because we won't put the country into debt unless it's to line our own suit pockets. You have my word. Now, my private physician has told me that if everyone in the country was as well off as I was, that we wouldn't be needing bulk billing, which is the real scam. He said if he could charge $150 per 5-minute visit, he'd financially be able to buy himself that second yacht. I really feel bad. Such a hard-working man only has one yacht. Nobody ever thinks about the doctors in these, which is why instead of making things more accessible to those who are poverty-stricken through no act of our own draconian laws, we've decided, in any emergency, to take whatever little money you have. We, the Fibrils, are aware that this cuts a bit deep. We do our best to maintain a certain level of cunning, to bring our wasteful spending in check by burdening the people with the difference. We tell you we manage the economy. But since Kevin Rudd, we have managed to triple the gap with a $1 trillion deficit. And we aren't quite sure why. It doesn't matter anyway, as we've just made it the burden of the public in the most direct way possible, with a rising cost of the bare minimum aged care that us Fibrils have set as a gold standard in this country. I'll leave you with this one last final thought. Does man really need that titanium hip at 73? Good innings, boomer.